Now, it's my honor to introduce Dr. Zahraa Kazee. And Dr. Zahraa, I hope that I'm pronouncing your name in the right way. Kazee, she is a homeopath in private practice in Johannesburg, South Africa. Her practice oversees acute, chronic condition. She volunteers her time at a rural homeopathic clinic in South Africa, where homeopathy is a frontline treatment for many individuals. And I think we are very happy to listen to your experience to offer people as the first line treatment. Thank you so much, Dr. Zahraa. The microphone is yours.
Thank you very much, Professor Yusuf. I'm just going to quickly share my screen. Is that correct? Can everyone see?
Yes, yes.
Correct.
Go ahead, Doctor.
Jazakallah. Assalamu alaikum. My name is Dr. Zahraa Kazee, and I will be presenting on the use of homeopathic remedies in trauma cases. As we know, there's a siege in Palestine that has left thousands wounded, and with the continued bombardment of the Gaza Strip, healthcare facilities and humanitarian aid efforts are at the brink of collapse. And so we turn to alternatives. With the heightened restrictions on humanitarian aid, we then look to using alternatives that may prove beneficial in treatment. So homeopathy then is quite suitable because of its versatility. Remedies can be used for acute conditions, for chronic conditions, and can be used very safely as an adjunct to other treatments. It also is very gentle acting and suitable for all ages, and can be taken either acutely over a shorter period of time or for chronic conditions over a longer period of time. However, there are remedies that can be used in the current siege conditions where conventional medication is limited from a supply component. I've listed just 4 remedies in each category, but homeopathy is very extensive and very expansive, and is often individualized. So this list is not limited to just these remedies. There are a lot of other options. But given the type of injuries that we're seeing, the traumas that we're seeing, these might be the best fit. Arnica montana, which is fairly well known, can be used for injuries where there is extensive bruising, often accompanied by physical and mental exhaustion. Bellis perennis is made from a plant, is also specific to soft tissue injuries, especially those of the pelvis, the coccyx, and the breast, as well as any sprains or very large bruising. Symphytum, which is often referred to as bone knit, has the property of healing fractures. So that would be used in any injury with bone involvement or fractures that need healing. Also, where there is an element of numbness that is associated with the pain. What's important to note with symphytum is if you're operating on a fracture that then needs a pin that will be later removed, or any type of orthotic that will be removed, the symphytum must only be started after that pin has been removed, so as to avoid any complications. And then ledum pallister is specifically for puncture wounds, ankle sprain injury, and where the skin is very purple and cold to touch. Ledum can also help relieve swelling. We might also see in a hospital or in a trauma setting many burns and wounds. The 4 remedies that I've outlined are calendula, which can be used in its tincture form, in its raw form as an antiseptic, or in remedy potency for superficial burning and scalding. Gunpowder is also a remedy made from actual gunpowder. It was initially used in World War II to protect against wound infections, and where there's slow wound healing. It's protective against abscesses, sepsis, or osteomyelitis. So any type of very severe infection, gunpowder would be very useful in this case. Hyposulfuricum is probably less severe than gunpowder. Your wounds also have an element of suppuration, but you're looking at your cold sores, your ulcers, abscesses, boils, broken skin, where there is an infection, but it's not as extensive as in gunpowder, where the infection has spread. And lastly, silica is in homeopathic potency or dilution can be used to promote the expulsion of foreign bodies from soft tissue. So in the siege conditions in Gaza, this may be useful for the removal of shrapnel as well, where surgical operations are, or operative measures are not a viable option. As we know, anesthetics and anesthesia has been limited, and many operations are performed without anesthesia. And as a result, we may turn to other remedies that can provide somewhat a form of relief, a form of pain relief. So the first would be Hypericum perforatum, also known as St. John's wort, which is an excellent remedy for any type of nerve damage, specifically where there's crushed extremities, and for cases of excessive pain. It can also be used post-operatively where the patient is still experiencing pain and there's no access to painkillers or analgesia. Chamomilla is made from the chamomile plant, is specific to unbearable pains with numbness associated with the patient feeling numb within themselves and the parts that are affected feeling numb. The patient is often described as feeling very restless and very irritable. Then coffea cruda is made from the roasted coffee bean. It's for neuralgia of any part of the body and a complete intolerance of that pain. Oftentimes, the patient shows intense hypersensitivity and are very agitated as well. And lastly, Arsenicum album, also used in potency form, acts profoundly on any organ or any tissue and is characterized by debilitating or debility, pain, a low vitality, and septic infections. Oftentimes, especially in the clinics in South Africa, we find that Arsenicum album is used and works incredibly well when it's used very early on in the treatment protocol for patients. Then following on into blood loss, whether a patient has had blood loss or any type of fluid loss post-operatively or from traumas. We start with yarrow root, which is called Achillea millefolium. This is an invaluable remedy for any type of hemorrhages where there is profuse bright red bleeding. We think to hemoptysis, nose bleeding, internal bleeding, and Achillea stops that profuse blood flow. It acts as a vasoconstrictor, if you will. And then phosphoricum acidum is for debilitation from the loss of vital fluids. So whether it's blood loss, vomiting, gastro, any type of electrolyte imbalance or loss of vital fluids will be this remedy, PhosAc, will be very useful for. The patient will also be very nervous and physically exhausted, completely run down as well. We then look at ferrum metallicum, which is iron, specifically useful in anemic patients with dyspnea and paleness, and where there has been excessive bleeding. And similarly, ferrum phos may be used as a hemoglobin enhancer. There are various studies that point to the use of ferrum phos to increase hemoglobin levels in patients with excessive blood loss. And then finally, hamamelis or witch hazel may be used as an astringent to reduce bleeding for painful wounds with weakness due to blood loss. And this may be used after surgery or in trauma cases to stop bleeding. And then lastly, a few first aid remedies, which because homeopathy may reduce the burden on the healthcare system, if we use it as a triage format, the following remedies may be used in certain instances where we then can manage slightly less severe cases in a clinic or at home where hospitals have been overburdened. So the first remedy being aconite is a frontline remedy for shock, for trauma, for any fever, injury, influenza, or any type of infection. At the clinic in South Africa, we often give patients a small bottle of the aconite remedy to take home with them. And we often say that if any type of symptom has come up, any shock, any trauma, any sign of an infection, we ask them to please start with that remedy first. We then move on to Ipecac or China officinalis, which is excellent for gastroenteritis. Belladonna can be used in fever, inflammation, headaches, and palpitations. And lastly, Cantharis is useful in urinary tract infections. I recently saw a documentary that speaks to the conditions and the sanitary conditions in refugee camps and how access to the lavatory systems is very limited and also very overburdened. And so the number of urinary tract infections has risen, and so as a result, this may be very useful. And that is my collection of remedies that I thought would be useful. If there are any questions, please feel free to share them.
Yes, thank you so much for this very practical lecture. As I said before, as I am a surgeon, we love practice information. So actually, you gave us a very practical approach to homeopathy. I have two questions on the chat box, and me myself, I want to ask two questions. I will start by the two questions. Does this homeopathic medicine work in trauma settings? Are there any randomized controlled trials on this? So he is looking for the evidence in managing trauma patients.
Great. So often homeopathic medicine, there are lots of clinical trials, randomized control trials that show the effect of using arnica, Bellus perennis, symphytum, etc. If one does a Google Scholar search, or if you can email me, I will then send all the relevant links.
Thank you. Can you please put your email address, please, on the chat box, please?
Sure.
Yes, and the second question: how long it takes for silica to expel shrapnels or foreign bodies once the medicine start using it?
Usually within a few hours. So we would do continuous doses of the silica in, I would say, 6 CH potency, so in a dilution of 6. To repeat it, I would say within a few hours you should be able to see that expulsion. So it's often very useful in splinters, etc. as well. You apply it to the area, or the patient can ingest it, and that will help to expel from the tissue.
Yes. So my questions, number one, I think any remedy should be given to a patient under strict medical follow-up, because broad symptoms like nausea, vomiting, or so and so, the patient may have, for example, vomiting from a serious condition, not from a functional condition. So I think he should be under strict guidance or follow-up by a physician. You agree with me?
Absolutely, absolutely.
Okay. The second question: you think in places like Gaza, where there is no access to remedies, can they manufacture or have what you call some local remedies from available materials, available plants, available herbals, or what you advise for this condition?
I think it's very possible to manufacture locally. Oftentimes, a 6CH is one of the lower potencies of homeopathy, and it's been diluted 6 times. So from the crude substance, for example, we spoke about Coffea cruda being the coffee bean, you can actually manufacture, and the materials that are required are fairly straightforward. Medicinal alcohol, a bit of water. So if an individual was trained in how to manufacture, which is very simple, they could very much create their own batch of medication within the Gaza Strip.
Yes, and if there is any online manual or way to manufacture, or what you call it is a personal experience, or what?
There would be an online, we'd have to find one. I would assume that, so we learned it as part of our medical training as homeopaths. They call it homeopharmacopoeia. So it teaches you the step-by-step method of how to manufacture your own remedies.
Okay, and my last question, because I lost the connectivity for 1 or 2 minutes at the very beginning of your talk, is all these remedies are systemic, or some of them are local and others are systemic?
Homeopathy is very individualized, and so any remedy may either be used as localized or systemic. It very much depends on the injuries of the individual, of the patient themselves, which is why it's quite a valuable tool to use, because you can alter it depending on the condition and the type of patient. And similarly, you can alter the dose and the frequency depending on the condition and the severity of it as well.
Okay, thank you so much. Thank you so much.